Autism, also known as autism spectrum disorder, is a neurodevelopmental disorder involving communication, social interaction, play, and the way the child presents to the world with or without the presence of repetitive behaviors. Most people would say that by 1 year of age, if a child is not babbling, ba ba ba, not pointing for things they want, or parents see difficulty with eye contact, that those are really some of the initial signs. Then, of course, if a child is not beginning to say phrases by two, maybe showing repetitive behaviors, this is certainly mounting concern. The young brain is such a plastic organ that the most effective therapy is intense early intervention. That involves speech and language therapy, occupational therapy as needed, and intense behavioral programs with parent involvement in the home, as well as professional direction from people who are trained in the various therapies that children receive. The most important component of the behavioral therapy is to establish eye contact, communication, pointing, and then move a child so that this generalizes into their peer and school environment. There are a good number of children who are diagnosed prior to the age of 2 who, with early intervention and early preschool, continued preschool intervention, on reevaluation, don't necessarily meet the full criteria for that diagnosis upon kindergarten entry. They may have some language-based learning issues. They may have some inattention, maybe some awkwardness in social interaction. But the depth of the symptoms that were present when they were under 2 really respond to early intervention. And that's why all of us who are passionately involved in children with autism and other developmental disabilities are just so wanting physicians to identify it early. The Center for Children with Special Needs at Floating is a comprehensive multidisciplinary center. And the years of experience that both the developmental pediatric medical specialists and the professional clinicians have evaluating children is what you want for the benefit of the child you're evaluating. A comprehensive approach for children with a spectrum diagnosis is important. And being in a place where the professionals can not only communicate individually with the parents, but can communicate with each other and develop a plan over time how to work with a child is so beneficial. And I think by having that plan, it helps parents reduce anxiety. There's no doubt that things come up at later times as the child grows, but that's true of all parenting. And I think that's what we're there for.